Hello, my name is Ben Rossavik. Thank you so much for taking the time to listen to our poster presentation today at OSU-CHS Research Days 2021. Today we'll be talking to you about common respiratory findings seen in follow-up chest imaging of COVID-19 patients. Before I begin, I'd just like to say that we have no financial or non-financial competing interests to disclose. Severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, is responsible for the coronavirus disease 2019, also known as COVID-19, pandemic. It is an airborne respiratory infection with multisystemic involvement, notably in the upper and lower airways. Clinical manifestations range from asymptomatic to respiratory failure requiring advanced airway placement with mechanical ventilation. Although this is a multisystemic disease process, chest imaging has been used to assess patients during and after hospitalization. The objective of this study was to assess common findings seen in follow-up chest imaging studies of patients who were diagnosed and treated with COVID-19 at our local tertiary center, specifically St. Francis Hospital here in Tulsa, Oklahoma. As for acute infections, bilateral pneumonias can be seen on chest x-rays with ground glass opacities in COVID-19. Chest CT findings can be abnormal as well. In one multi-center study from China, chest CT was abnormal in 125 of 131 patients. Bilateral involvement was seen in 79% of cases, with the majority having multi-lobar involvement. Multiple lesions were present in 87% of the cases. As for the methods that we used, we performed an institutional review board-approved retrospective chart review of patients who were hospitalized and discharged with COVID-19 from St. Francis. The EMR was accessed, and a list was generated in Microsoft Excel of COVID-19 patients who were diagnosed by PCR. Patient data was collected for those who were admitted from March to August 2020. Chest X-ray and chest CT findings were reviewed anywhere up to 200 days after initial admission. Imaging studies were obtained during initial hospitalization, subsequent hospitalization, or emergency room visits that occurred within the health system after discharge. The imaging studies were reviewed, specifically those pertaining to respiratory status, and the findings were compared. As for our results, a list of 232 individuals was generated, and the average age of diagnosis of those individuals was 74.8 years. 48 patients had follow-up imaging available for review, and that imaging included chest x-ray or chest CT. 39 patients had chest x-ray findings available, and 9 had chest CT available. The more common findings seen in the follow-up chest x-ray or chest CT studies were coarsening pulmonary vasculature, most commonly at 52.1%, followed by atelectasis at 27.1%, and then cardiomegaly at 22.9%. As for our conclusions, this study demonstrates the more common chest x-ray and chest CT findings obtained in follow-up assessments of COVID-19 patients who were hospitalized at our tertiary center. Chest imaging studies are one of the available ways to assess follow-up in patients hospitalized with a diagnosis of COVID-19. Following chest imaging studies provides one way to assess recovery and complications from COVID-19, although the disease includes multisystemic involvement. Coarsening pulmonary vasculature was most commonly seen in the follow-up imaging studies results that are available in our patient population. Although studies are needed to assess lasting effects on pulmonary function, follow-up chest imaging studies may provide prognostic value in assessing disease outcomes in COVID-19 patients. Here you can see an expanded view of our results, where we list the most common findings in chest x-ray and chest CT findings. And at the bottom of this table, you can kind of see the percentage of the total patient's imaging. As you can see here, coarsening pulmonary vasculature was seen most commonly at 52.1% of all these imaging findings. Here you can see the references that I used for today's presentation. If you have any questions, please don't hesitate to email me at my OSU email. Again, my name is Ben. My first name is Ivar. Ivar Ben Rossavik is my name. And you can email me here at evar, EEVAR, at okstate.edu. Thank you so much for your time. Have a great day.